Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. And as you know, we have the best, the greatest, the changers that are changing medicine today. And today we have one of the best, Vincent Pedre. He is an internist, and he's the gut expert. Dr. Pedre, thank you for coming and joining us.
Now, it's a pleasure.
Pleasure's all mine, honestly speaking. Tell me about gut health. Happy gut.
Oh, it's gut health is everything. I think we need to change the way that we look at health and the paradigm of medicine. And I think for the last 100 years, we've kind of missed the gut. The gut was like, when I went to medical school, felt like the gut is the least sexy organ system to pay attention to. I talk about how the gut is your inner skin. Mm-hmm. And if you want to look good on the outside, you need to start with the gut. The gut is the foundation for everything. And it's also the hidden source for a lot of inflammation in the body. Right. So when people are reaching a point where, and I think I see this on social media, people reach out to me all the time, they get their healing to a certain point and then they're stuck. And they can't get past that point, and it's because they haven't paid attention to their gut. And we have an epidemic of gut disorders worldwide.
Correct.
Because of antibiotics, because of too many processed foods, because of too much sugar, because of toxins in the environment, in the air, toxins in our food, pesticides. All of this is causing major gut disruption, and then on top of that, stress, which I call it an attack on the gut. And so because of that, I think it's becoming more and more important. People always ask, why is there so many gut health issues now that didn't exist before? If you ask doctors who have been gastroenterologists for years, now they're seeing more IBS now than they ever did earlier in their career. And it's because of all these reasons. We've changed our food supply. We've infiltrated the food supply with things that you cannot even see. You can't smell pesticides. You can't see them on your food, and yet they're there. And you might think you're being the healthiest person as possible. Like a patient of mine recently who is a pilot, at home with his wife, they have the cleanest diet you could imagine. All organic, all fresh vegetables, very plant-forward diet. When he travels, he might pick up things at the airport, and you would think that that's okay.
No.
You know, so we did a toxin panel on him because pilots also get exposed to jet fuel and all that. But what really surprised me in this person who doesn't have a lot of exposure to this, his glyphosate level was through the roof. And this is the person who's eating really healthy. If I have you look at this person in front of you right now, you'd say this is a healthy male. Muscular, fit, not heavy. You wouldn't even be able to tell me that he has a high glyphosate level.
So what's his symptomatology that brings him to you?
It's the reason he sees me is more about health optimization,
right,
which is interesting because I have a subset of patients that come see me for gut health issues. And it's interesting because the gut is the gateway, the reason they come in, but it's not the only reason because you don't just have gut issues and not have chronic fatigue, migraines, joint aches, muscle pain. So everybody with gut issues comes in, they have other issues going on that are immunological issues or whatever related to the gut. Then I have another subset of patients who are healthy, but they want to stay healthy, so they come in for health optimization, and they've realized that the gut is the foundation for all that. So they want to make sure that their gut foundation is good, and they want to work with me to, if they're at here, they want to be optimized. They're biohackers. They want to be the best that they can be.
Correct. So back to the pilot, the glyphosate level. So you found out, and what did you do about it?
So you've got to look at where is this coming from? Right? And we know that, for example, non-organic wheat gets sprayed with glyphosate, with pesticide, and it's going to be contaminated with that. So he was sometimes picking up a pizza in the airport or a sandwich.
Right.
So you've got to then realize, okay, if you're going to live a clean lifestyle, it's got to be a clean lifestyle throughout every action that you take. Because he doesn't live near a farm, he's not getting exposed through the air. So this is another way that might be surreptitious. And this is what anybody who's in gut health understands that you're almost like a medical sleuth. You're always looking for the hidden things that are causing issues. Glyphosate is in Roundup, which is a weed killer that people can go and buy at Home Depot and spray on their lawns. So the other question was, well, do you have lawn? Do your neighbors have a lawn? Do you know if they spray glyphosate? Because why is your glyphosate level so high? So you have to think like that. You have to almost be like a detective.
Totally.
And think, where is this coming from for this patient? And then reduce the exposure and optimize detoxification to get this out of the body.
How do you optimize the detoxification?
Number one, you got to make sure that people are pooping.
Correct.
If you're not pooping, you're not detoxifying.
Correct.
So you've got to get all of those toxins out. Most people, they think that going to the bathroom 2 to 3 times per week is enough. It's not enough. You have to be processing out every day. You can use binders to help bind, and you use binders of different types like pectin, chlorophyll, bentonite clay, activated charcoal. So different types of binders that can pull things out of the body, and then supporting liver detoxification with liposomal glutathione, NAC, things to help encourage the release of toxins through the bile as well as through the urine. And that's how, and then of course, also very important part of the process, ideally if you can get the person to do this infrared sauna, and if you can do dry brushing to stimulate lymph flow before the infrared sauna. And if you want to go really intense, you can pre-treat them with niacin before they go into the infrared sauna so they can really sweat out.
Do you do IVs?
I don't currently do IVs. I used to do IVs. And then
what changed?
Post-pandemic, I just shifted my practice, became more virtual and less in person. Right. So I stopped doing as many IVs, but I used to do IVs for immune boosting.
Yeah, we find that working.
For gut healing.
Yeah.
Yeah.
You're 100% correct. I mean, the gut is really the most important part. I mean, all the hormones, the peptides, everything gets made in the gut. We found out that that's the case. We went through the leaky gut period, and now you're there helping people realize.
And I think also really important to understand that, a lot of people are thinking that zonulin is the key, the answer to leaky gut, and if zonulin is not present, if you don't detect zonulin in the stool, it doesn't mean that leaky gut isn't present.
Exactly.
If you have zonulin antibodies, great. That's an indirect way to look at. Maybe you have anti-lipopolysaccharide antibodies, but there's another pathway that I lectured about today at A4M Spring Congress, and it's actually an autoimmune pathway through IBS that is caused by an IBS that starts with a gastroenteritis from a Campylobacter, Shigella, E. coli, or Salmonella that produces cytolethal distending toxin that breaks down the cytoskeletal structures. The body will actually form antibodies to this cytolethal distending toxin B, and then those antibodies cross-react with vinculin, which is a very important cytoskeletal protein. It binds the actin to the desmosomes that are connecting the cell to other cells, and it breaks down the cell and causes leaky gut without zonulin being elevated.
Right.
So there's a whole other pathway to leaky gut that is affecting patients with IBS that can lead to autoimmunity. The cytolethal distending toxin actually cross-reacts with a bunch of different tissues in the body, including receptors like the acetylcholine receptor, intrinsic factor, and then it actually also can cause food sensitivities. In one study, they found that cross-reactive antibodies, cytolethal distending toxin, reacted to 20 different foods.
So what do you do clinically?
You have to resolve.
Tell us like the sequence of events.
You have to resolve the inflammation,
right.
The underlying inflammation. So you start with evaluating what is going on in the gut. Is there a dysbiosis? Is there leaky gut? Is there SIBO? Is there small intestinal bacterial overgrowth? Then depending on that, you choose a treatment plan. I'm a big fan of serum-derived bovine immunoglobulins as part of the treatment plan, spore-based probiotics. Depending on the patient, if they're constipated, you have to be careful with SBIs. That reduces inflammation. The SBIs bind lipopolysaccharide. They protect the epithelium from getting exposed to this, from crossing the gut barrier, and it allows for that tissue repair to start. You use things like L-glutamine to help with repair. And I think not enough people are using Butyrate as another nutrient to help repair the gut lining, but Butyrate has receptors all over the body.
Right, and as you go up the villi, you have more Butyrate you need.
It helps with satiety, so it helps with knowing when you're full, but it also helps with cholesterol metabolism, with brain-derived neurotrophic factor.
Beautiful.
So it improves brain health. It helps modulate the nervous system. So people who are chronically overactive immune system, Butyrate is a great nutrient for that. And then another underappreciated nutrient is to help rebuild the mucin layer. Right. The mucin layer helps protect the gut lining, because when the mucin layer is healthy, there's an inner and an outer. The inner is right next to the villi, and that inner layer is bacteria-free. It's in the outer layer where the commensal bacteria live.
Right.
And the Paneth cells are secreting antimicrobial peptides that help keep that inner mucus layer free. And now what we're understanding in studies is that we can use pomegranate extract, so polyphenols, to rebuild the mucus layer, citrus bioflavonoids as well, to rebuild that mucus layer. And it's another thing that we have to think about with these patients, because you might not be able to give them prebiotics if they have bacterial overgrowth. If they're really sensitive to prebiotics, they're going to make them gassy. So you can use an alternative technique, which is give them polyphenols, the microbiome doesn't metabolize polyphenols into methane and carbon dioxide and all that. So you don't get the gas that you would with the prebiotics. So it's almost like a backdoor way to help treat these patients that you can't put on prebiotics, and they might not even be able to tolerate a probiotic.
Right.
So you start with that, and then of course everybody's stressed, and stress is an attack on the gut. So you have to work on rewiring the nervous system, the vagus nerve. Activating low vagal tone is a very important part of the healing process. And then you really rebalance and reinforce those things, because you want to create an internal resilience that prevents the recurrence. And I find that the mind-body piece, the mind-gut piece, is a very critical part of preventing these patients from reactivating and coming back with the same issues again.
So they have to understand what you did and how it got there.
Yeah, and that it's not all nutrition is important, supplements are important, but you can't out-diet and you can't out-supplement a stressed-out lifestyle.
Right, exactly. I have to end on this one because it's perfect. Thank you so much.
You're welcome.